Hello and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Yesterday, the government announced that not only was it extending the second movement control order, but that it would also seek to tighten SOPs. However, no details were announced as to what these stricter SOPs would entail. So in this information vacuum, a coalition of more than 40 trade, business and professional associations have urged the government to lift the second MCO, saying that the restrictions would likely kill businesses and leave many jobless. Are we getting this balance between saving lives and saving livelihoods right? Tonight on the show, we'll speak to two public health experts. First up, we have Dr. Farhan Rusli. He's Assistant Professor of Health Policy, Economics and Finance at the International Islamic University, Malaysia. He's also Director of the Selangor Task Force Operations. Good evening, Farhan. Thank you so much for joining us on the show. Now, good, thank you. I want to begin our conversation by by getting your thoughts on how, on the consistently worrying and high number of daily cases versus the appeal by businesses and workers that they cannot survive yet another MCO. What does this balancing act between the two sometimes competing priorities look like to you?
So first, good to be on the show, actually.
Thank you for being
good to have you here.
It's nice that you use the word balance. So when you talk about balance, you talk about the balance between health of citizens and the health of economies. So in essence, what is it actually? So you actually have to understand that in order for you to achieve this balance, number one, you actually have to accept that the COVID-19 virus is with us, right? The pandemic is not going anywhere and the virus is not going anywhere. Number two, you must open all the businesses, but with strict SOPs and guidelines. Now, this balance can be struck if only both sides understand what needs to be done. And from the health aspect, we must understand that there's no such thing as trying to keep locking or trying to prevent things or trying to lock businesses from operating, because we have seen what it does, and it doesn't give any positive any positivity to the economy, and also it doesn't bring any of the cases down. So to strike this balance, you have to understand that
the people must understand that when we open up the economies with strict SOPs, that you will have
Farhan?
cases. That,
Have we lost Farhan?
Hello? Can you hear me?
Please continue talking.
Yeah.
Yes, continue.
Sorry, I don't know
Farhan.
why I lost you there. Yeah.
That's okay.
So-
Please continue.
You must understand that there is an acceptable threshold which is set by the WHO, which is 5%. So we have to prime the people and tell the people that, yes, you will find cases. It will be less than 5%. There's nothing to worry about. The cases are there, but however, you must take care of yourselves. The economy must continue, and this is the only way that we can actually strike the balance between lives and livelihoods.
Farhan, as Director of the Selangor Task Force Operations,
Yeah.
I wonder if you can tell us, is the Selangor government and the task force pulling in a direction different from the federal government and those tasks to kind of lead the federal strategy?
Okay, it's not that you have to understand something, right? What happens with the Selangor government, or what the task force is trying to do, is that we're trying to complement what the federal government is doing. You have to understand there's a very big distinct line that we do not cross. Like, we do not say that we are going to take over whatever the federal says, or we're not going to follow what the federal tells us. But what we do is that we enhance things that perhaps the federal has missed, or perhaps the federal has overlooked, and we fill in those gaps, such as making sure that the public health measures, enhanced public health measures at targeted areas are being done. Because what the task force emphasis is not more on testing and lock up, testing and lock up, testing and lock up, because that doesn't bring us anywhere, right? It doesn't solve the core problem. The core problem and the core issue that the people need to understand, that this is a public health issue. And public health is all about prevention, right?
Right. So, Farhan, so in that regard, Farhan, because the federal government seems to be intent on using lockdowns as a major plank in its strategy, surely that contradicts what you were saying earlier about lockdowns not being effective and in fact damaging to both livelihoods and not having an effect in terms of the pandemic.
Okay, you must understand something, right? From the way I look at things, okay, if you want to impose a lockdown, I think everybody will be okay with it as long as you explain what is the purpose of the lockdown, what are you going to do on day 1 of the lockdown, what are you going to do on the day 3 of lockdown, what are you going to do on day 7, what are you going to do on day 14. You need to come up and tell the people exactly what you're going to do. And I'm glad, Sharaad, you brought this up, because on the 25th of January, we heard somebody from the health ministry say that we cannot impose another lockdown because it's too detrimental to the economy. And we hear the finance minister say that there will be lockdowns will cause economies and SMIs to collapse, right? And then suddenly we hear the defense minister say that we are going to extend the lockdown for another 2 weeks for all states except for Sarawak. So you have to understand, right? This is where the breakdown happens between whatever happens in the government and the people, because you don't have a clear narrative, right? There's no uniformity in the message that's being given to the people, right? The SMEs are all ready to open up because they understood that the number one in health was telling us that the lockdown was not going to extend. And when they were prepared, suddenly they said that, no, you can't operate because we're going to extend it.
Okay, and also this, I think, the extension every 2 weeks also causes some uncertainty with businesses. But I want to follow up on this, this information vacuum or this mixed messages that you're talking about, talk of tighter or stricter SOPs. That's come amid rumors that all sectors of the economy might be allowed to reopen. There was a sourced story in the Star today that's making the rounds on social media. I'm wondering, this kind of competing narrative, this mixed message about perhaps tighter SOPs, but the economy allowing to be fully reopened, is that an approach of where we're thinking about restricting personal behaviors or educating personal behaviors rather than limiting certain sectors of the economy?
Okay, you have to understand something, right? Because the economy does not cause an outbreak of the virus. It doesn't cause a blast of the cases to go up. Now, the cases blow up because people do not follow SOPs. People don't follow wearing masks. People don't keep social distancing. That's what causes the blow up of the cases, not the economies being open. Now, when you hear about all the sectors of economies being open and implementing of the strict SOPs, that is the way forward. However, when you announce this, that you are allowing all economies to open, you must understand that you cannot have a blanket rule on how economies are supposed to operate, because a barber may be different from a farmer or from a grocery. And you have to make sure that the SOPs that you are trying to give to the people is concise and clear. It cannot be too technical. People will not be able to understand, and people will not be able to comprehend if it becomes too strict or too rigid. You just have to go back to the basics in essence, so that the economies can understand and they can operate, so that they can actually operate in a safe manner. And this is what we are saying, that this is the balance that you are looking for, Mel.
Right, Farhan, there's another issue around the question of lives. We have the lives versus livelihoods, but we also have different types of diseases in society. Do you think that in terms of our record over the last almost year now, that we have sacrificed people suffering from all other kinds of diseases, non-COVID diseases, because of this overemphasis on, on this particular dimension of the public health crisis? Have we sacrificed and created collateral deaths as a consequence of the strategies that we've taken?
Absolutely. Absolutely. I completely agree with that statement, because you have to see, right? Because when you start to focus on a certain agenda, right, you have a small focal fixation on something, you tend to block out all these other things that are equally as important, right? And if you want to talk about statistics about the number of deaths in COVID, which are about 400 plus, and you compare it with those from dengue and from these other diseases, now I know that the Ministry of Health is actually focused, and they're actually going out on all these other issues and other diseases that's contributing to the society. However, a lot of manpower and resource are being placed into the COVID fight. However, it should be that way, but the strategic planning needs to be good, right? We have to understand that the circuit breaker that was told to us or sold to us Now somebody has to say it, right? The circuit breaker didn't work, right? The circuit breaker didn't happen. The whole thing just exploded, right? That's why we had touching 5,000 number of cases. We touched 4,000, right? And that's what happened. What we need is actually a complete reset, right, of the entire system. We need to, how do we say? We need to inject new ideas, a new strategy, and we have to replan.
If I may interject and ask you then, what would you like to see for us to get ahead of this of the infection rate of the virus, the outbreaks? You cited that the number. We've already had 4-digit cases for a while now. What would you like to see in terms of how we should get ahead?
Now, the answer is really simple, Sharaad. You have to understand, right? You have to go back to the basics, right? It's the basic principles. You have to be ahead of the virus. You have to be ahead of the curve. It's no longer about flattening the curve. It's that you have to get ahead. And how do you get ahead? You get ahead by implementing public health measures which are targeted, which actually emphasize on the reduction of crowd gatherings, to tell the people that, look, for the next 1 year, you're no longer going to have weddings. Nobody's going to get married in a big ceremony anyway. You're not going to go into a field of footballs, into a stadium and get together with a lot of people. You have to get them primed. You have to tell them, for the next 1 year, this is how we're going to live until we reach the vaccination policy of 82.5% or whatever the number is that we're going to reach. We have to tell people how they can prep themselves and what are the things that they have to do, instead of telling them that, look, during MCO, you can do this. After that, we're going to relax. Oh, it's becoming really bad. We have to be tight again. And then we relax, and then we are tight. So it doesn't bring us anywhere, because technically, 1 year on after COVID has started, we are worse back from where we started now.
Okay, well, Farhan, thank you so much. We really do appreciate you joining us on the show and you sharing those insights. Thank you for your time tonight. We're going to take a quick break here on Consider This. We'll come back and speak to another public health expert on this issue. Stay tuned to Consider This. Hi, thanks for staying with Sharaad and I on Consider This. Let's continue our look at the balance between saving lives and saving livelihoods in our COVID-19 public health measures. Joining us now, we have Professor Dr. Syed Muhammad Aljunid Syed Junid. He's the founding professor and chair of Health Policy and Management at the Faculty of Public Health at Kuwait University. Welcome to the show, Professor Syed. I wanted to ask you about this second MCO that's now been extended. There's been pushback, not just from business owners or from businesses, but also from public health experts who have been stressing yet again that lockdowns are blunt instruments when it comes to curbing the spread of COVID-19. How are you thinking about this, Professor, in terms of the balance between ensuring that the epidemiological curve is flattened, that we're getting ahead of that curve without having to shut everything down?
Yeah. Thank you very much, AWANI, for having me. And very interesting question. To answer to that, to the questions that you raised, we have to look at what happened the last 12 months or so. And if you see that the first lockdown was actually carried out immediately after it had been, WHO has declared that it is a pandemic. And the idea was actually to flatten the curve. That was the terminology that was used, the term that was used. But we see that after a while, starting from September onwards, after the cases have come down quite a lot, significantly, now the cases have started to escalate. And we see now nearly about 4,000 to 5,000 cases a day in Malaysia. So in total, we have about 223,000 cases. Globally, at the moment, we have 103 million cases. And Malaysia is quite lucky because our death rate is much lower compared to many areas in many countries in the region. Maybe because we have a better health system, we have achieved universal health coverage, and people are getting good quality of services when they go to the government hospital. But the idea whether the next MCO, which has just been imposed and now it is in the process of being extended, will have any impact or not on the COVID-19 pandemic that we are seeing happening in most countries in the world. From the issue of looking at the balance between the life and livelihood, we can see that the impact on livelihood is very severe due to the pandemic itself, and also because of the MCOs which was set up. As a public health physician, we support the MCOs which was first implemented in the early stage to actually flatten the curve. But now, after we have done for a number of months, we can see that the impact on the economy is very bad. Globally, it's estimated that the poverty rate for the whole world, whole countries in the world, is actually escalated to nearly about 150 million, which is an additional of 80 million people are pushed to become poor because of this pandemic. And this is very serious. And the other issue is that if you look at the, in terms of the losses of jobs, in terms of the loss of income by the population, is very significant. In Malaysia itself, there was a study.
Yes, Dr. Aljunid, if I could interrupt you for a second, I just want to ask you, people might even, accept a level of economic, negative growth if you could say that, or make the argument that MCO actually works in terms of the disease. But public health experts are also saying it doesn't work. It's not efficacious when it comes to dealing with the disease. So why continue with these lockdowns if they are neither efficacious to the disease and in fact have a detrimental effect on the economy?
Yeah, that's right. I mean, we supported the idea of having MCO at the early stage of the pandemic, but not now at the moment when things can be controlled through other mechanisms. I think if you look at the impact of the economy, it's very bad. And at the same time, what are the major issues with the MCOs that they are implementing now? I think in Malaysia, sadly, we can see that it was not actually implemented properly. At the moment, you see the MCOs that we are implementing have a lot of loopholes and also a lot of people being filtered through the system without being done properly. Exemptions were given to people who are in power to actually travel from one place into another. They are the focus of infection. How can these MCOs to be effective anymore? So we have to actually move forward and try to find other things. Population are seeing the MCOs which are implemented with a lot of loopholes and weaknesses, and they don't respect anymore these MCOs. As a result, people at this stage, what we call they might have gone through a process of what we call the pandemic fatigue, not only because the pandemic has been strengthened for quite some time, but the way that we implement MCOs is very weak. So,
the senior minister, Ismail Sabri Yaakob, has said that the second round of MCO will come with stricter SOPs. No word yet as to what those the stricter SOPs entail. But I'm wondering, if we have stricter SOPs, will that lead to more punitive measures for SOP non-compliance? Or have we, in this past year, adapted enough, educated the public enough to know that there are behavioral changes and adopting or complying with SOPs is no longer an issue? I'm worried that punitive measures for SOPs, as you brought up, might be selectively, enforced, or even it could disproportionately affect the underprivileged.
You are right to say that. I think it was not properly implemented. The enforcement was very selective. So people actually, at the end of the day, feel that they wouldn't bother anymore to follow the system. We must ask ourselves why this happened. This is because we are actually not implementing it seriously, and people who are actually at the lower rung of the society are suffering quite a lot. They are the ones that being penalized if they actually break the SOP. Whereas those in power, they were actually allowed to move around without any much a problem. So at the end of the day, MCO is not the solution to what we are having now. We must move into another or other ways to actually do this.
Dr. Aljunid, can we turn our attention to the vaccine? Because we seem to be on the threshold of a vaccination program. And there's already a debate, I think, partly because of the way Britain has decided to strategize its vaccination program, going ahead with vaccinating as many people instead of keeping to the protocol of a second jab after 3 weeks. Where do you stand on this? How should we think about this vaccination program? Get as many people first or follow the protocol strictly?
Actually, if you look at the way that we manage pandemic, if we have a mechanism to manage it through the primary prevention, which is actually vaccination program, we must actually take this advantage. At the moment, the technology are quite advanced. We have a number of vaccines that are proven to be effective. Of course, when the companies and also the authorities that are involved in producing these companies, they try to produce it as fast as possible. And as a result, they might actually break the usual protocol. But I think we have no choice at the moment. If we want to achieve more forward and control this pandemic, we must actually go and get the vaccine and try to vaccinate as many people as possible. I think most of the vaccines in the market, there are at least 4 or 5 types that are available. They have a very good efficacy rate and it's quite effective, and they should be given to the community as fast as possible. Of course, we must do a few things. Number one, you must monitor the side effects. Any vaccines, any drugs will have a side effect, and this needs to be monitored because some of the trial were conducted in a smaller scale, and we are having problem of understanding whether the effects or the side effect of this has been reported properly or not. And these actually have an impact. The population nowadays are very educated. They get information from all sources, including the social media. Anything, any death related to or linked to the vaccination will be propagated, and people might not accept the vaccine. And
well, how would you then, Professor Syed, how would you then address the public apprehension and anxiety? It's undeniably there, but I also would posture that, you know, the extent to which people trust the system or trust the vaccines will also depend on the extent to which people trust the system that supports the vaccines.
If you look at the overall vaccination program in the world today, we have a group of people who are anti-vax anyway, and these numbers are growing and growing. And as a result, we are going to face a huge challenge if we don't actually educate the public and then mobilize the resources properly to get people to accept to receive the vaccine. We need to actually enhance our health education so that people will be able to get a proper information. And our staff that are going to actually vaccinate or provide the vaccination, deliver the vaccine, must be trained as well. They themselves must be trained on how to handle the situation and how to handle the side effects if there are any side effects reported by people. And then they must actually be properly monitored as well. So we need to do this. And we have to have an adequate budget in the public health section, because the public health section of Ministry of Health is the one that will be involved on the day-to-day running to provide the vaccination program to the community. So, and then one more thing that we have to do, we have to mobilize resources from other sectors as well. We cannot vaccinate or achieve a good coverage if we just depend on MOH facilities. We have to get in the private sector. We have about a huge number of maybe 5,000 to 10,000 of GPs running the clinic. They should be mobilized to provide the vaccine to the people as well. In that way, we will be able to achieve a good coverage. And these are some of the issues that we need to solve. We must have a proper strategic plan.
Dr. I could just ask you in the last minute or so that we have, you're there in Kuwait speaking to us. I understand the United Arab Emirates has already started some weeks ago on its vaccination program. What can we learn from the way in which Middle Eastern countries have conducted their public health programs?
I think one thing that I learned and we can learn from the situation in Middle East is that the situation here is that people actually share the information about this with the experts. I'm involved with the Ministry of Health of Kuwait to provide support and to provide ideas. We share a lot of information. This is not actually quite readily available in Malaysia. And then they listen to the advice from the experts. And the other thing, of course, the positive effect is that they have money. That's why they can order the vaccine faster, they can mobilize the people faster. But other challenges are there. And the good thing is that Malaysia should learn on how to actually do data sharing with the expert, listen to the expert, and we have to reduce politicking. If we get politicians to interfere with the activities which are actually advised by the experts, I think this is what happened in Malaysia now.
Right. Thank you so much for your time joining us on the show tonight, sharing those insights. We appreciate the perspective that you bring from the Middle East. Thank you. That's all we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
Thanks so much for watching, and good night.